There we go.
Now
This is if you want lights. You have some lights there?
And you said ask for a vice chair? Good morning. Do we have a person who would like to sit as vice chairman?
Dawn.
Or we can appoint one.
Yeah, you got one thinking. Come on up. Did you bring your name tag? Come on. Oh, you won't have much to do. You won't have much to do.
It's just if the chairman passes out, your chair. Randall's not back. Have him read it. I'd like to call the meeting for the Silver-Haired Legislator Bill number 4001 to order. And may we have it read?
Yeah, that's
You guys are
where
supposed to
you
read
guys
it?
help, right?
Okay. Randall, we went ahead and started with the other one.
Yeah,
You're fine.
go ahead. Well, we're going to start with 4001. You weren't in the room. He had already called it to order.
Okay, did we start the 4001 yet?
Yeah.
Yeah, he's handing out information on it. They were getting ready to read it.
Okay, that's fine.
You're going to wait.
I come after.
Yeah,
Yeah.
you don't have to wait.
Okay, go ahead.
Thank you, Mr. Chairman. Silver-Haired Legislature Resolution Number 4001 is a resolution urging the legislature of the state of Kansas to support the expansion of Medicaid in Kansas. The resolution reads, whereas for the first time, Kansas's 2021 uninsured rate of 9.2% was higher than the uninsured rate in the United States. And whereas of the nearly 264,000 Kansans who are uninsured, 150,000, including an estimated 16,000 uninsured Kansans aged 60 to 64 years, currently fall into the Medicaid coverage gap by being too young to qualify for Medicare and making too much money to qualify for Medicaid, but too little money to afford private insurance. And whereas Medicaid expansion would improve health outcomes by reducing the number of uninsured Kansans, improving preventative and primary care access, providing substance abuse treatment and mental health counseling, and reducing the mortality rate. And whereas Medicaid expansion would create more than 23,000 new jobs in Kansas. And whereas Medicaid expansion would protect access to care, especially in rural areas, by decreasing the burden of uncompensated care for hospitals and other medical care facilities across the state. And whereas if Kansas expanded Medicaid, incentives passed in the American Rescue Plan Act of 2021 would increase the federal medical assistance percentage for currently enrolled KanCare members by 5 percentage points for 2 years. And whereas federal funds would pay for 90% of services provided to the expansion population. And whereas Kansas's continued participation should be contingent upon the continuance of the 90% match. And whereas leveraging the federal resources that come with Medicaid expansion is Kansas's biggest opportunity to finance healthcare reform efforts, now therefore be it resolved by the silver-haired legislature of the state of Kansas that we urge the legislature of the state of Kansas to support the expansion of Medicaid in Kansas. Mr. Chairman, I'm happy to stand for any questions on the resolution.
Are there any questions for the resolution?
I have one. In regards to the expansion for medical care in the state and everything, will it also help, will the money provided for the expansion of it, will it also help to bring back some of the hospitals in the healthcare industry that we have lost in previous years?
I think some of the proponents may be able to speak to that better than I could.
Anybody have any thoughts on that, especially the ones from the rural areas? Do we have anything on that?
Okay, are there no other questions? Thank you.
I'm from PSA 8. Does that also include transportation costs to and from our? I just want to ask.
I know, but this is the whole point.
No, I'm Memory McGinley, PSA 8, and all I want to know is, does that include transportation costs? I'm in a county that has no health care at all. We have to go out of county. So,
You need to sit there. We're going to have testimony, and you can ask them questions.
I can sit up there, but I'm not guaranteeing you anything.
That's okay.
Okay. There's no other questions, then we would start with hearing from the proponents. Jamie Reaver. Please introduce yourself, Jamie.
Good morning. My name is Jamie Reaver. I'm the Executive Director of Kansas Appleseed Center for Law and Justice. We're a nonprofit, nonpartisan organization dedicated to the belief that every Kansan can and should live in thriving, just, and inclusive communities. Some of the issues that we primarily work on include ending hunger, reforming the foster care system, and getting out the vote. Kansas Appleseed supports expanding Medicaid. More than 150,000 Kansans fall into a health coverage gap created by our state's failure to expand Medicaid. Expanding eligibility will support some of the most vulnerable and hardworking citizens of our state. If Kansas expands KanCare, 90,000 uninsured adults aged 19 to 64 would become eligible for coverage. 68% of uninsured adults are living below the federal poverty level, and 75% of Kansans who would be eligible for KanCare coverage under expansion are part of working families. Expanding health care coverage through Medicaid to low-income Kansans will save and improve lives. For example, in states that have expanded Medicaid, annual mortality rates among near elderly adults were reduced by 9.4%. Access to health care for this population is proven to reduce disease-related deaths. A review of over 600 studies that have been conducted since states first started expanding Medicaid shows that expansion states have better outcomes in mortality, cancer, chronic disease, disabilities, sexual and reproductive health, behavioral health, state finances, racial disparities, socioeconomic disparities, and better social detriments of health than the states that have not expanded Medicaid. Individuals with coverage are less likely to face catastrophic medical costs, leave bills unpaid, or borrow money to pay for medical care. A recent study by the Economic Security Project found 32% of Americans don't have $400 in spare cash to cover an emergency expense. Think about that. One emergency room visit, a dire diagnosis, or a costly prescription could send a Kansan into a financial tailspin, and this is a medical debt that might follow them around for the rest of their lives. Healthcare is a necessity and should be treated as such. If all Kansans are to thrive, it is essential for Kansas to expand Medicaid to every Kansan who needs it. Promoting the general welfare of the public is a founding principle of the United States Constitution. We urge the silver-haired legislature to support Medicaid expansion in a way that ensures every Kansan has access to life-saving medicine and health care. They deserve it. Thank you, and I'll stand for questions at the appropriate time.
I have a question for you. And yes, I was, copies of that. You made mention of the foster care program. In speaking to one of the ladies in one of my Silver Sneakers classes, she has her 3 grandchildren in her house, but because of their income, the grandparents' income, they don't qualify for any aid of any kind for the help of those 3 grandchildren. And she brought up the fact that foster parents who get state aid get money allotted for children that aren't even theirs. Is there any way that we can, that can be expanded on that, where that even if they don't get a full allotment as a foster care parent would, that at least a grandparent would get some sort of supplement to help with the grandchildren that they are now raising?
That is something we're absolutely working on. I believe that's called Kinship Care. And, we think that kids in the foster care system, they deserve to be with individuals who they know, with a family member. We see, time and time again that a child who needs to be placed in foster care has family that are willing to take them, but the financial burden of being able to have another 1, 2, or 3 children in our household is just way too much. And so that is definitely something that we've been advocating for.
We haven't gotten anywhere with it.
Not yet.
Okay, thank you.
Thank you.
Good morning. Thank you for having us. My name is Lacey Kennett, and I am the Director of Communications for the Alliance for a Healthy Kansas. The Alliance is a coalition of more than 125 organizations whose first policy goal is to improve access to care by expanding CanCare. Alliance members include business leaders, doctors and hospitals, social service and safety net organizations, faith communities, and chambers of commerce, among others. Since the Alliance was formed in 2016, we've engaged with thousands of Kansans, and it's clear and supported by polling data that Kansas overwhelmingly support expanding CanCare. A recent statewide poll shows that 78% of Kansans support expansion. It's no secret that costs are rising and Kansans are paying more to take care of themselves and provide for their families. Healthcare costs are no exception. Expanding CanCare will reduce healthcare costs for everyone by providing health insurance to 150,000 residents. When low-wage Kansans can't get health coverage, that means more in ER bills, increased uncompensated care for hospitals, and untreated mental and physical health needs. This means everyone ends up paying more for health care, and expansion can bring down these costs for everyone. The income limits to qualify for CanCare in Kansas are some of the strictest in the country. A single mother with 2 children would need to make less than about $8,700 per year in order to qualify for coverage. Expanding CanCare would allow her to work more hours or get a higher paying job without the risk of losing her health coverage. Our rural healthcare systems and communities need CanCare expansion. Rural Kansans sometimes have a hard time accessing the healthcare they need when and where they need it, and rural healthcare providers face high levels of uncompensated care. One of our storytellers from Wichita, Jim, was a farmer all his life. He developed diabetes and an injury to his foot, which left him unable to farm. Unfortunately, he falls in the coverage gap and struggles to get the health care he needs to get back to work. There are currently 53 rural hospitals in Kansas at risk of closing, more than any other in a state our size. The Kansas Hospital Association, Ascension Via Christi, Kansas Academy of Family Physicians, the Kansas Nurses Association, and the Kansas chapter of the American Academy of Pediatrics all support CanCare expansion. We trust our healthcare providers to care for us when we need it the most. We should trust their opinions and experience when it comes to expansion too. Kansas is being quickly left behind because of our refusal to expand CanCare. All of our surrounding states have expanded their Medicaid programs, making it more difficult for border communities to compete for jobs and economic growth. Other holdout states, like South Dakota and North Carolina, continue to make strides towards making Medicaid expansion happen, while Kansas stubbornly refuses to do what is best for our state. According to a 2021 report from the Center on Budget and Policy Priorities, 26% of those who would become eligible for coverage under expansion are between the ages of 50 and 64. This could be a widow who was a homemaker her entire life, or a man who wanted to keep working full-time, but a health condition keeps him from being able to do so. It might include those early retirees on a fixed income trying to make ends meet in a world where everything keeps getting more expensive. KanCare expansion is not a political issue. It has bipartisan support. 38 states, including many traditionally conservative states, have chosen expansion and not looked back. Tens of thousands of Kansans have signed petitions and attended community events and rallies in support of expansion. Our support grows by the year, proving that Kansans are more than ready for a long-term solution. Please join the nearly 8 in 10 Kansans who agree it's time to expand KanCare. Thank you.
Are there any questions for Lacey? Randall?
Thank you, Mr. Chair. I might beg to differ with you about Kansas not being political.
Okay.
I think as hard as you try to make an argument and as many arguments as you make, it is difficult to, my experience is being on the Senate side, there's a hesitance or let's say, well, they're just not interested in promoting Medicaid expansion, no matter what the benefits to the state and no matter how many hospitals might close because of the loss of funding. So I think it's a mountain that we have to climb that other states don't have to worry about because they're using more common sense when they're talking about the issue. So I applaud you and support you and in our group, and I'll be back in January making the rounds, and it'll be on the tip of my tongue, front burner. You better believe it. So thanks for all you do.
Thank you.
And do we have a representative for the Kansas Hospital Association?
Good morning, everyone. I'm Tara Mays with the Kansas Hospital Association. It is a pleasure to appear before you this morning. I am here proudly representing our 123 community hospitals across the state of Kansas, and I just want to thank you again because we very much appreciate the opportunity to share a little bit about why we think Medicaid expansion could be helpful in the state of Kansas. Like you've already heard this morning, we believe that KanCare expansion is a very pragmatic solution that offsets some of the things that you've heard about. Uninsured medical losses for our Kansas hospitals, certainly it helps with that, but it also aims to provide access to affordable health care for more than 150,000 Kansans. And in addition to that, it reduces the overall financial burden of uncompensated care to our hospital systems, to other patients, and really to our communities at large. Right now, there is very much a cost shift that occurs. When some of those folks come in with uncompensated care, we have to look to counties and other localities to fill in those gaps. And they do that in property taxes. So there really is a cost shift that occurs when we talk about KanCare expansion in a lot of different ways. According to our Kansas Hospital Association ticker, right now, Kansas has forfeited a little bit over, I checked yesterday, $5.8 billion in federal funds that are going to other states currently. With all of our surrounding states, as was mentioned this morning, having now gone the route of expanding this particular program, the lack of expansion really does have a new sense of need and urgency in the state of Kansas. The latest Kansas expansion proposal here legislatively assumes that the total cost of expansion is $772 million for those 150,000 Kansans. With the feds paying that total price tag for 2 years under federal law, the net of the costs and the related cost savings is a total savings to the state of Kansas of $38 million over the course of the next 2 years. After that point, the state would then be required to pay 10% or $77 million of that cost, with a net cost of about $37 million to the state of Kansas after those 2 years. This does not reflect the additional revenue that would be generated by adding $772 million to the state economy in total. That's estimated to be about $30 million for the state, but also $25 million for local units of government across the state of Kansas. So for our hospitals, expansion really equates to a very practical and very pragmatic workforce solution. With employees' ability to be able to work in hospitals in surrounding states and some of our border communities that are financially less at risk, the lack of expansion can quickly put our hospitals here in Kansas at a competitive disadvantage to be able to have resources with which things like wage adjustments can be addressed. So additionally, we know that those most likely to fall in the existing coverage gap are those that are really working in the service sector. With such a large employment need in our state, the need to look at expansion beyond just a healthcare need, but really it's a small employer need across the state of Kansas. According to the latest studies, expanding KanCare would increase our total state's economic output. So that means the number of times that that dollar rolls through a particular community by about $17 billion. And it would increase personal income for Kansans by about $6.3 billion over the next several years. This will continue to grow as we look towards the end of the public health emergency, and many of those Kansans that have been covered by Medicaid during the public health emergency, they are likely looking at losing coverage over the course of the next 5 months. So the need to expand that population is going to continue to grow. So there is a renewed need for conversations around ways that we can improve this program, whether it's expanding our covered population in the Medicaid program, or looking at reimbursement rates that haven't been increased for decades, or coming up with improvements in ways that we provide Kansans with mental health services. We hope that there will be continued interest on ways that we can work together to tackle all of those things. And I did hear a couple of questions earlier that I just wanted to address with you this morning. One of those was, would KanCare expansion help previously closed hospitals? The truth is, it really, like any business, when you look at reopening a hospital, you're doing a business case analysis. And so you do that business case analysis without expansion, and it provides one set of books. You do that business case analysis with expansion, and it provides another financial outlook. So could it help? Yes. But the other question that I heard that I wanted to address is, will this help in terms of transportation for those communities without necessarily any healthcare services? And Medicaid expansion doesn't necessarily have a tagged line for transportation in it in the proposals that I have seen. However, there's an indirect impact in that if you have hospitals that are having more folks that are coming in that are covered, there's more resources to be able to stretch to be able to provide things like transportation. So it's an indirect impact in both of those questions that I heard this morning. With that, Mr. Chairman, I am happy to answer any additional questions that the committee might have.
Are there any questions?
I have one. And also, do you have a handout on that?
Yes.
Yeah, it's on that. Yeah, okay. Thank you for addressing the issues on the hospital, and I understand what you're saying in relation to the transportation issue. And here again, the right hand is going to help the left hand, which in some cases, as Randall has stated, some politicians aren't worried about helping the right hand and the left hand. But also you made the comment that we are forfeiting $5.8 billion in federal funding. And I might have the wrong, did that go back to the Affordable Care Act that was passed in a previous governor that initially turned down all of the federal funding that was to be provided out of those CARE Acts? And because all of the dollar amounts that you provided were only in the millions, they don't equal up to $5.8 billion. So the cost out versus what we would take in there's a great difference there. I mean, how can you not do the dollar amounts and do the addition unless you're not wanting to do the addition? So
maybe a point of clarification, the amount of money that under the KanCare expansion proposal goes back to the federal government and then gets allocated to the states that have already expanded. So that is the pot of money that you mentioned.
yeah, so, okay, all right, thank you.
Are there any other questions?
I have a question. We have been, Silverhead has been a supporter of KanCare expansion since its beginning. And one of the things that we have tried to inform our people on, and anyone that we're speaking to, is that Kansans are already paying for this. In fact, they're paying for it twice, because our tax dollars are going to Washington, which is then divvied out to the, would you say, 39 states? We're not getting that. Secondly, then at our local hospital level, when there is a shortfall, the residents, either through tax levies, through whatever, then pay again. And so we've tried, as Silverhead from the very beginning, to make people aware of the fact, folks, you're paying for it twice, and you're getting zero benefit. And yet we are not able to convince, especially leadership on the one side, that that's something that's very critical to the state. Do you guys have any ideas at all, short of the ballot box, how we can, number one, as Donna said, get them to understand that it is important for our citizens and that it is in everybody's benefit if we have this, not just the 150,000 people that will be the first direct recipients? Hope that made sense.
Well, I appreciate the question, and while I don't offer a magic bullet, I'm always open to suggestions. So appreciate the sentiment very much, and I think, to your point about paying for it twice, that's very important. To the point that having these conversations as it relates to where we are today in terms of workforce shortages, I think we're in a very different situation than we were when we began this conversation several years ago, particularly in the service sector for our small businesses throughout the state of Kansas. So I would say renew emphasis on how we can really impact the workforce can be helpful in the conversation.
I have a question.
Sure.
Let's say those funds are allocated, is there a way that, like Donna expressed, closed hospitals, is there any measures taking that won't just go to big hospitals, but also the small and rural hospitals?
I think I understand the question to be, is there any assurances in the legislation or in the policy that those funds would go to small hospitals versus large hospitals, if I'm getting that right? And I think
Or at least the rural and the small get a portion of it.
Yeah, well, I would say, as we look at all of our hospitals and their uncompensated care and the numbers of their population that fall into this coverage gap, there's a natural conclusion to be drawn that it would certainly help our rural community hospitals. That being said, the legislature did pass the Rural Emergency Hospital Act to also provide kind of a critical lifeline for our folks that are hospitals that are in kind of tough financial situations to be able to keep their doors open using some specific measures. So I think in tandem with both Medicaid expansion and the Rural Emergency Hospital, it certainly gives our rural hospitals more options to keep their doors open.
Good. Thank you. Randall.
Okay, thanks for your presentation this morning. This question is only partially connected to Medicaid expansion, and that is thinking about the loss of population, and especially in western Kansas, and how that might affect the viability of hospitals that serve that area. And I was curious, does that come to something like a 1-2 punch when it comes to how smaller hospitals in western Kansas are able to survive over time?
Yes, so certainly population decline, but also I would say, you know, one of the realities that exists about medical care is that it's just inpatient volumes and times for people that have to stay inside our hospital walls has gone down tremendously, and that's a good thing. We should all celebrate the fact that you can get a surgery and be out of the hospital the next day. That's terrific. But it does have impact on volumes because, as I mentioned at the beginning of this, you know, we're a business like a lot of other businesses, and so certainly population decline is an additional complication, but also your inpatient volumes and the times that those patients are staying, they do make the books balancing a little more complex. So all of those things happening at the same time are certainly a part of it, which is why we're hopeful that the rural emergency hospital can be helpful, but certainly Medicaid expansion would be really, really helpful for our rural hospitals as well. Thank you for the question.
Okay. My question is, basically, the questions seem to revolve around the medical care that we would get, like at Stormont Vale or those kind of hospitals. What about mental care, hospitalization, whatever?
Yeah, no, I appreciate that question. And you know, certainly we see volumes and needs in terms of behavioral health throughout the state of Kansas continuing to increase. We actually had testimony before the interim committee on mental health beds that are looking at the need for adding additional bed capacity here in the state of Kansas. And so there are a lot of folks that come in for mental health services, as you might imagine, that don't have coverage. So certainly in terms of mental health, care expansion could be very helpful and beneficial in providing those services as well, whether you're in an urban area or in a rural area.
You have a question?
Yes, Mr. Chair, we have a question from Jan Kimbrell on WebEx.
Okay.
Hi. Hi. Jan Kimbrell, PSA 8, representing Morris County. My question to the hospital person that was just speaking, when you look at numbers and you're making your reports, are we considering in the county the percent of people that fall into the gap area of not Medicaid coverage as opposed to the actual numbers? Because in some counties, they may have a low population, but the percentage of the folks that are in that poverty level or that lower income level is a lot higher than in some of the larger counties. And I'm just wondering, is it always sheer population numbers that they're considering, or is it the percentage of folks that live in this county? Is that?
That's a terrific question. Thank you so much, Mr. Chairman. So they do, when we do analysis for our individual hospitals, they look at both the number of folks that currently fall in the gap, but also as a percentage of the population to be able to get a total picture of what that looks like in terms of impact to that hospital.
Thank you. Are there any other questions? Thank you very much.
I just have one for all of you speakers. Since this is an election year, I have constituents, I have people that I have discussions with that go, well, how do I know who is actually supporting me? And here again, I tell people that I talk to, look to who is actually supporting you, the working class citizens, those of low income, those that are of the elderly, the frail, whatever. And here again, a lot of areas don't have internet services to go out online. These facts, figures, and data that are actually true for what you are, because of the areas that you work in, it needs to be published. It needs to be put out there so that people can read it and understand. Okay, here's the situation, this is what's going on. And I always look at it, the more we are informed and the more knowledge that we have, the better off that we are, especially when it comes time to go vote. And with all of the lies, innuendos, whatever you want to call it, is out there now. Look at your facts. I would ask the public to get it out there so that we can read it. Everybody can read it. And thank you. Yes.
I'm so glad you mentioned that, because at Kansas Appleseed, we work on getting out the vote. And our research shows us that communities that vote are healthier communities. They have, better access to nutritious food, they have better health care, they have better schools, they have better housing. It is so directly linked. And at Kansas Appleseed in 2020, we really did a voter engagement effort to make sure that Kansans are voting in their best interest. And so we went out to low propensity voters, voters that have not been engaged in elections on a regular basis. And we really also highlighted families that make $50,000 or less. And we did, sort of the typical get out the vote, where we had a lot of touches with texting, postcards, and really helping raise the issues. Not talking about candidates, just about the issues that impact their lives. And of the individuals that we tracked in 2020, when we had the typical 7 touches with them, we saw a voter turnout increase of 48% amongst those voters. So I think educating voters, letting them know what the issues are and how they impact their lives, that matters tremendously, and we're really committed to doing that. So, an excellent point, because the data shows that it works.
Thank you. We'll now close the hearing. Then do we vote on this now too? The other one? Okay. All right. Okay. We're now going to open for the resolution of 4003. We'll have the reading of the resolution.
Good morning, committee. Silver-haired legislature resolution number 4003, a resolution supporting wireless broadband access for all senior Kansans, including the training and assistance for use of wireless internet. Whereas wireless broadband is essential for many tasks, from grocery shopping to healthcare to information regarding government resources and more. And whereas the demand for wireless broadband will only increase as more vital services for seniors move online. And whereas with this reliance, a lack of access to wireless broadband impacts the everyday lives of all Kansans, but particularly of senior Kansans. And whereas seniors and those living in rural areas are most at risk of having little to no reliable access to wireless broadband, equipment, and education necessary to use and participate in the benefits of wireless internet. And whereas, as the Kansas legislature reviews future projects and priorities, the legislature should commit to funding wireless broadband and connecting senior Kansans to the internet. And whereas, widespread wireless broadband connectivity will require investment, coordination, planning, and continued support. And whereas education and training for using the internet and technological equipment is also necessary for senior Kansans to fully benefit from the increased access. And whereas efforts to build and sustain infrastructure, invest in networks, support deployment across the state, and provide education on the internet use will allow increased access to much-needed wireless broadband for senior Kansans. Now, therefore, be it resolved by the silver-haired legislature of the state of Kansas that we support wireless broadband access for all senior Kansans, including the training and assistance for use of wireless internet. And I'm happy to stand for questions on the resolution.
you, Mr. Chair. This is fun to be back in this environment. The proponent testimony is provided by AT&T, and they were not able to be here. Typically, in a committee meeting, committees will receive both written and oral testimony, and they did provide written testimony, and it's not the general policy to read the written testimony, but since this is it, I thought I would go ahead and read that to you so that we could have a better discussion about the topic. And this is what they sent me. At AT&T, we know that connectivity plays a vital role in our everyday lives, whether working remotely, accessing telemedicine services, or simply seeing family members and friends. Technology and the connectivity it brings serve as a lifeline for many, especially over the last couple of years. As the use of connectivity and technology has continually increased, the need to be digitally inclusive should be at the forefront of all of our minds. Surveys have shown that up to 43% of adults over the age of 60 experience loneliness on a regular basis. Technology can play an important role in addressing isolation. The need for greater connectivity and digital literacy is especially urgent in older adults because they are the least likely demographic to be online in 2021 by a wide margin. In fact, age is a greater predictor of access than race, socioeconomic group, education level, or geographic location. In the United States, 25% of adults over 65 reports not using the internet at all. While there are a variety of barriers for each individual situation, we know that two barriers to connectivity are often access and affordability and low confidence in using technology. We are working closely with local communities and government leaders in Kansas to provide tailored solutions to the digital divide gap that we see in older populations. Presently, AT&T is hosting digital literacy workshops in collaboration with community partners like the Wyandotte Leavenworth Area Agency on Aging. Through our digital literacy workshops, we can empower older adults as they navigate the online world. Our employees also are investing in their communities by donating their time, expertise, and knowledge to help community members get connected to in an informed way. Access and affordability are barriers that go hand in hand in preventing online learning and use. We are addressing both. We have invested nearly $575 million in our wireless and wireline networks from 2019 to 2021 and have more than 1.9 million fiber optic strand miles in the state. By combining a new service plan from our low-cost access from AT&T's program with federal benefits from the Affordable Connectivity Program, or ACP, eligible households can receive home internet at the best monthly rate possible, $0. The work that the legislature is doing to bring awareness to the digital divide in older populations is important. AT&T's commitment to our communities committed to our communities, and we look forward to continuing and expanding our collaborative efforts to ensure all Kansans are connected to the future. During my time in the legislature, I was on the Utilities Committee, and so we had a fairly good communication stream with AT&T over time. And I was able to learn quite a bit about what AT&T is capable of doing and what they are doing in local communities to provide more accessible internet services. And this testimony addresses mostly the affordability and the accessibility to internet. The other part that I was concerned about coming from Saline County and knowing about the counties west, I was concerned about having the access to internet at all. And that was something that where I was going through a little bit of a learning curve because AT&T, I know, and possibly other carriers as well, but I do know that AT&T provides in rural areas something called fixed wireless internet. And fixed wireless internet is really kind of a slick deal. It provides internet that's connected to their cell phone towers out in western Kansas, but it provides internet services. So they have another device attached to the tower, the cell phone tower, and then that sends the internet signals to the homes in that area. So if you live within 3 or 4 miles of a cell phone tower, then that is how you could get your internet service. And it provides, I think it's a minimum of 10 megs down, 3 megs up, something of that sort. But anyway, I was encouraged by that. And I don't know how many people know about it. And I don't see AT&T really advertising it either. Maybe it's because it's not one of their big moneymakers. But at least I know there are attempts to provide internet to western Kansas. And so with that, I would stand for questions.
Are there any questions for Randall? Go ahead.
Is the, well, it said it would be $0 monthly rate. Is that based on income, or is that based on your usage, or is that for everybody?
I think that is based, that would be an income-based program. But even like with the fixed wireless internet, I think the fee for that is $50 a month, so it's not exorbitant. You know, the other alternatives that people have are satellite-based, and those can be rather expensive, up to $100 or something like that. So.
$50 for some individuals on fixed income
Right.
is exorbitant.
Exactly. But at least there is an option.
Well,
and things will get better.
You haven't got the money, you haven't got the money. I mean, that's.
But I have a feeling things will just get better and cheaper in the world of internet, like it has in a lot of other things that we have in technology, in the field of technology.
This is only AT&T.
Correct.
Right, so it's not all carriers.
Well, I'm not sure about the other carriers. That we would get testimony from Cox Communications, and they have a program like that, but I don't know much about it. But I do know in Salina, where I am, the AT&T is providing was providing fiber internet, which would be twice the internet for half the price of what we're paying now. So that, I think, as soon as things like that are available, then the internet becomes quite a bit more accessible.
Randall, can you tell me, is this program in existence now and funding? Because I know our local telephone internet company has received some funds to expand their internet services.
I think it is available through a federal program. I don't know at what stage it is right now, but we could find that out easily.
Thank you. Go ahead.
Yes, Mr. Chair. Jan Kimbrell has a question on WebEx.
Hi again. Hi, Randall. I know on a subcommittee, that task force that we have been looking at the past several months is some way to get internet services in community buildings, such as a senior center, and which would require some funding from the legislature to be sure that at least in a community, if the folks that live within that community do not individually have access to internet, that they could go to this senior service center, center, and there would be access available there with someone there who is knowledgeable in how it works, which would be training those employees, volunteers that are there. Have you heard any discussion about that at all over in Saline County or elsewhere?
You know, I have not. I do know, though, that there are other places that provide internet access, like our public libraries a big example in Salina anyway, that has terminals that can be accessed for various purposes. And so I appreciate the question. I don't know if there's anything, I can't remember anything happening recently about moving forward in that regard, though.
Thank you.
Thank you, Randall. Now we will work the bills. And vote on it, correct? And vote on it? Is there any further discussion on Bill 4001? Does that require a motion? I would entertain a motion.
I move that we report resolution number 4001 favorably for passage.
I'll second that.
Okay, it's been moved and seconded that we vote on resolution 4001. All those in favor?
Aye.
All opposed, same sign. Motion carried. And now we will vote on resolution 4003 on the wireless broadband access. Is there any further discussion? No? I would entertain a motion.
I move that we send resolution 4003 to the chamber favorably for passage.
Do I have a second? Second. It's been moved and seconded that we move this on. All those in favor?
Aye.
All opposed, same sign. Motion carried. We're adjourned. We are adjourned. Thank you very much.